GLP-1s like Zepbound, Mounjaro, Ozempic, and Wegovy are doing more than just helping people lose weight. They're tackling the disease of obesity and they're improving health in ways we never imagined. A groundbreaking new study has revealed that these medications reduce the risk of 42 different conditions, including heart attacks, Alzheimer's, and even substance use disorder. Stay tuned as we break down these life-changing findings and what they mean for your health. Hello everyone, and welcome back to the Downsized. If you're new to our channel, Laraine and I share our adventure with GLP-1s. We personally use Zepbound, Mounjaro, and compounded tirzepatide. Together, we've lost over 140 pounds, and these GLP-1s have been an essential tool in treating the disease of obesity. Before we dive in, please do not forget to like this video, subscribe to our channel, and share it with someone who might benefit from learning about GLP-1s. Every week, we bring you the latest research, news, and personal insights to help you on your health adventure. Today's topic hits close to home for me. Obesity is a disease that has affected nearly every aspect of my life, from physical health to emotional well-being. Like many of you, I've faced the challenges and the stigma and the uphill battle that comes with trying to manage obesity. But GLP-1s have given me a chance to reclaim my health and my future. That's why I'm so excited to share this groundbreaking research, the largest study ever on GLP-1s. This study, published in the journal Nature Medicine, is the most comprehensive research we've seen on GLP-1s. Researchers from the Veterans Affairs St. Louis healthcare system analyzed nearly 2 million people with type 2 diabetes, including over 215,000 who use GLP-1s. These are medications, as we all know, like semaglutide, which is Wegovy and Ozempic, tirzepatide, which is Zepbound and Mounjaro, dulaglutide, which is Trulicity, and liraglutide, which is Saxenda. So what were the results? Well, GLP-1s were linked to reduced risks for 42 different health conditions. Yes, 42. We knew it was a lot. I didn't know it was 42. The study went beyond what we already know about GLP-1s, like their ability to lower blood sugar and promote weight loss, and explored their effects on conditions ranging from heart disease to neurodegenerative disorders. So let's break down the benefits of GLP-1. Obesity is a complex disease that impacts nearly every system in the body. By helping patients lose weight and improve metabolic health, GLP-1s address many of the underlying drivers of chronic conditions. Dr. Zaid Al-Ali, the lead researcher, called obesity the mother of all ills, and I couldn't agree more. Next up was heart health. Well, GLP-1s significantly lower the risks of heart attacks, strokes, heart failure, and other major cardiac events. For anyone who's spent the last few decades of their life battling this disease, these benefits are of course life-changing, and I've personally been able to come off my blood pressure medication. Next up was brain and mental health. This is where the study gets really interesting. GLP-1s were associated with reduced risks of Alzheimer's disease. It lowered it by 12%. Dementia, which lowered it by 8%, and even mental health conditions like suicidal ideation, which went 10% lower, and schizophrenia, which was 18% lower. Researchers think GLP-1s may affect the brain's reward centers, reducing cravings and possibly even protecting against neurodegeneration. Next up was inflammation and immunity. Well, we all know it does something with that. GLP-1s reduce inflammation, which is linked to many chronic conditions. They also lower the risk of serious infections like sepsis, pneumonia, and chronic obstructive pulmonary disease. And then there was kidney and liver health. Well, GLP-1s also lower the risk of chronic kidney disease, acute kidney injury, lower cancer, and inflammatory bowel disease. It's not just about managing blood sugar. These medications are protecting vital organs, and of course, the substance use disorder. GLP-1s show a reduced risk for disorders involving alcohol, marijuana, opioids, and stimulants. This might be tied to their effect on brain pathways related to cravings, the same ones that help with appetite suppression. As we all know, there are some risks and there are some side effects, so let's talk about those for a minute. Well, no medication is perfect, and GLP-1s do come with risks. A few that were highlighted in the study: gastrointestinal issues, which we all know. Many of us know this well: nausea, vomiting, acid reflux, and abdominal pain. These are the most common side effects of GLP-1s, and while they often improve over time, they can be tough to manage. I've personally had some minor constipation, some minor diarrhea, nothing such that I would ever stop this medication. The benefits of the medication have far outweighed the side effects. Kidney stones was the next one the study found. They discovered an increased risk of kidney stones and inflammation in the kidneys. If you've had kidney issues in the past, make sure to talk to your doctor about monitoring this. The next watch out was low blood pressure and fainting. GLP-1s can lower blood pressure, which is usually a good thing. But if you're also on hypertensive medications, this can lead to fainting or dizziness. Adjustments to your meds might be needed, and I found this. So as my weight came down with these medications, and I was taking blood pressure medications, there was a period, I was moving my daughter into college, where I was having dizziness. Turns out my blood pressure had gone so low that I needed to have my medications adjusted. I worked with my doctor, and I'm now no longer taking those medications. The next one is arthritis and joint pain. Paradoxically, the study found an increased risk of arthritis in GLP-1 users. This might be related to muscle mass loss during rapid weight loss, but more research is needed. And finally, the one everybody's scared of, pancreatitis. Although rare, drug-induced pancreatitis is a serious risk. If you experience severe abdominal pain, seek medical attention immediately. For me, this study is more than just data. It's proof that GLP-1s are powerful tools in the fight against the disease of obesity. Before starting my adventure with GLP-1s, I struggled with hypertension, knee pain, and feeling stuck in a body that did not reflect my best self. These medications have changed that. They've given me a second chance at life. But I also know this is not a one-size-fits-all solution. The risks are real, and not everyone's experience will mirror mine. That's why it is so important to talk to your healthcare provider and make decisions based on your unique situation. The question then becomes, well, what's next for GLP-1s? The potential for GLP-1s is enormous. Could these medications be used to treat addiction, dementia, or even cancer? We're just scratching the surface, and ongoing research will reveal even more. GLP-1s are giving people like me, and maybe like you, hope. They're helping us treat obesity as the disease it is, improving not just our weight, but our overall health. If you found this video helpful, please like, subscribe, and share it with someone who might benefit from learning more about GLP-1s. And let us know in the comments, what's been your experience with GLP-1s? Have you noticed unexpected benefits or challenges? We'd love to hear your story. Thanks for watching. As always, I'm Christopher Durham, and we are the Downsized. See you next time.